So if you've tried everything and you're still having trouble losing weight, the problem isn't your willpower. Obesity is a medical disease, a condition that requires treatment medically. So it's been known for many years that obesity is a medical condition that has a lot of different variables associated with it. It's not necessarily just because you overeat. Because if we look at it genetically, we can see patients who are people who are overweight and they have mothers, fathers, grandparents, sisters, brothers who are overweight also. And the real issue is, what are those genetic components? Well, we don't have it's not a clearly one genetic component, just like people who have high blood pressure or have high cholesterol or who have diabetes have genetic components, but they don't necessarily know if there's a specific one. So in these cases, what we see is basically a family history of being overweight. And in that situation, we also know that there are a lot of what we call neuroendocrine hormones that are associated with people's set point for their weight. So this set point is defined by hormones like ghrelin, leptin, and a number of other well-known hormones. And we don't really understand all the specific interactions between them from a clinical perspective, but we realize that some of them have promote weight gain, some of them promote weight loss, and there are genetic conditions that have been used as models of these sorts of neuroendocrine hormones. My point is again, this isn't something that can be fixed with just saying I'm going to lose weight and I'm going to change my diet. Although certainly changing your diet, increasing your exercise, all of those lifestyle things are very, very important and are the basis for any medical weight loss type of program. And so the other aspect now that we have available to treat weight loss is medications. And we've known certainly about medications for years and years, but none of them have been very effective. You would get a very small percentage of your weight down and then stop the medication and the weight would come back. So most of them were not very effective. But now we have effective weight loss treatments, and we have treatments that can help you lose weight of about 15 to 20%. And, that's really, achieving weight loss that is close to what bariatric surgery has been doing for weight loss over the last several years. So we can now use a medication in a controlled setting under a physician's supervision that can give you weight loss over a period of time. And again, we look at weight loss in the same way that we look at conditions like diabetes, hypertension, hyperlipidemia. We're trying to prevent diseases that are associated with being overweight. Heart disease, sleep apnea, arthritis, a number of different conditions like that, all of which relate to being overweight. And we can help people in that regard. So medications have been revolutionary in our current treatment paradigm for weight loss. And so, as many of you know, there are multiple different medications now that are available, and we can utilize them individually based upon circumstances that make one better than another, and that can be again done under a physician's supervision. So endocrinology happens to be the really one of the best places to go for this kind of treatment. And the reason is because the treatments are with these medications that we call GLP-1s, the common medications that we're using today for weight loss. And the fact is that endocrinologists have been using GLP-1s for treatment of diabetes since 2006. And we have these many, many years worth of experience as these medications have gone from only diabetes medications to now medications that certainly still treat diabetes very well, but also treat obesity as well. And so we have this experience level on both the efficacy, meaning how well they work, the side effects that no real other group other than people who have been obesity trained physicians have used for years. So endocrinologists are in the best position to give you a very good idea of what the benefits and risks would be of taking one of these medications. So patients who are obese have to fall into a range of what we call a BMI, which is the index, which essentially is related to your height and weight, and is, although not a perfect way of approaching, any kind of obesity sort of measurement, it is the current standard. And so we have to use that standard to determine whether someone qualifies for medications. And you qualify for medications if you have a BMI over 30, or if you have one or two risk factors for heart disease, a BMI of 27 or above. And so those are the patients who are able to get these medications for obesity. Again, if they have diabetes, they're getting the medications for the diabetes indication, and the weight, the BMI, is not the specific value that we use to make a decision. But having said that, many of our patients who have type 2 diabetes are obese or have a BMI that's over 27 or 30. So just like in every condition, all the medications work a little bit differently in each individual. So everything is individual, and we've seen people who have been on the lowest dose of these medications do extremely well, and we've seen people on the highest dose of these medications have minimal amount of weight loss. So the published data in most of the studies is around 15 to 20% weight loss over a year's period. And so that's what the expectation should be. But the other thing that we have to be aware of is, with every medication, just like with every medication that we take for other conditions, there are side effects. And the side effects are fairly common side effects. They're nausea, most common side effect. Some people have increased acid reflux, heartburn. They may have constipation. They may feel bloated. And there are a number of other lesser known side effects that might be, or lesser common side effects that might be associated. And there's a list of them that would be available. But then there are also these benefits that we know about. It turns out that these drugs also have benefits in decreasing the risk of heart disease in patients who have had a history of heart disease. They also have helped people who have sleep apnea specifically. So there are some specific indications in patients who have these conditions as well, and those have been studied in detail. And there'll be more conditions that have been studied in detail, because we're just really on the early stages of looking at all the benefits and risks of these medications. Although, as I said, we've had a 20-year experience with GLP-1s. Being used in this setting for weight loss has not been as long a period of time. And so with the large number of people who are obese, 40 of the population of the United States is obese by BMI standards, we are going to see a lot more people on these medications. So we'll see some of those both benefits and risks show up as time goes on. So there's always a question that comes up is, well, what happens when I stop the medication? What happens if I don't take it, or I stop it and don't take it? Well, it would be unrealistic to think that if you stopped the medication that you wouldn't have some recurrence of the weight. Now, whether or not it's a full amount of the weight or some part of it kind of will depend on many factors. It might depend on the medication still having some impact. I don't know if there's been any studies that actually can document that. But of course, hopefully the lifestyle changes that have been made, in terms of diet and exercise, would also have a continuing ongoing impact. But in reality, treatment may need to be more lifelong, just like treatment for diabetes is lifelong, treatment for hypertension is lifelong, treatment for high cholesterol is lifelong. We don't stop those medications and restart them. If a patient is deemed to have those conditions, then typically they need to be on those medications if the indications are the same and if the side effects are not significant. So that's what happens if you stop the medications. Your weight may come back. Finally, I think it's important to recognize that we're not just looking at it in relationship to losing weight. Okay. We hope that you lose weight to get to a certain point, whatever that decision is between you and your physician. But the real point is the health benefits. What can we provide in the long run? Because we're really talking about preventing disease. So just like all these other medicines that we use to prevent disease, it should be a long run that we're looking at. And then, we have the opportunity and really love to treat patients to see their benefits with this condition. We have a dietitian and a full set of providers who are interested in working with people with obesity, because we think that it really is the important aspect of prevention, which will keep our patients and our country healthy.